me, Dr. Dipashti, Dr. Ketan, and Dr. Harita. All of us, you please give us host, right? Okay, so let us start today's session. So the first session we are going to discuss on quality control in antimicrobial susceptibility testing. So this is again a very important aspect of AST, because unless you have a robust mechanism to know that your AST methodology is appropriate, it is very difficult to say that the antibiotics what you are reporting is going to work effectively in vivo to the patient or not. Okay, so to have a reliable AST report, uh, you have to have a robust mechanisms to know that the methodology is correct or not. Okay, so we will start with one question first. So can you on the poll one, please?
Yes, sir.
Poll one has got how many questions?
The poll one have three questions.
Three questions.
Six
So
questions. Six questions.
6 questions. So we'll give some 3 minute so that even the other participants also will join
I'm
by.
launching the poll.
Yeah, you launch the poll. So there are 6 questions.
Time
So
start now. You have 3 minutes for polling.
I mean all the questions of QC session we are showing you together. These are the 6 questions of the QC session.
Sir, we are unable to choose options for the poll.
You're unable to choose.
Options are not, when the poll opens up, it is not getting selected. Even the submit option is not coming.
I'll just launching the polling.
Unable to choose the options as a panelist.
Now you can choose. Time starts now. Now you can choose the option. Two minutes left. One minute left. 30 seconds left. Time is up. Polling is closed now.
So please display the result of the first question.
I'm showing the result.
Yeah.
Third result.
Thank you. So the question what is asked here is disk diffusion test. So, the question what has been asked here is disk diffusion test. So in disk diffusion test, what is the QC you have to use when you are testing for all these isolates drug bug combinations? So here the wrong answer is option C. Option C, because for enterococcus, if you are doing a disk diffusion test, then the Staphylococcus aureus ATCC strain would be suffice. Only when enterococcus, when you do a MIC based test, you have to follow the enterococcus faecalis ATCC strain. Okay, so this is the crunch here which you need to understand. So the next question also a similar question. The QC strain requirement for MIC differs from disk diffusion test. So if you are doing a disk diffusion test, there is a set of QC. If you are doing MIC, then there are a set of QC. There are some overlapping QC strain also. Like for example, enterobacterial, non-fermenter and streptococcus, both MIC and disk diffusion QC strains are same. Whereas for Staphylococcus aureus, there are two different QC numbers. There are two different ATCC numbers which are used for MIC and disk diffusion respectively. So the next slide, what I will show you, you don't get scared. It is going to be an exhaustive slide. However, I will explain you a simplified format of this, which will be easy for you to understand. Okay, so this is the exhaustive list of QC requirement of disk diffusion test. So for if you want to test for enterobacterial, then it is a E. coli ATCC 25922, a disk diffusion test. If you want to test, then this is the QC strain which is applicable for enterobacterial. And along with ectobacterial, even Vibrio and Aeromonas also have the same QC requirement, except for when you're testing for carbapenem alone for enterobacterial, Vibrio and Aeromonas, the QC strain requirement is Pseudomonas aeruginosa ATCC 27853. Similarly, the the Salmonella, Shigella, Vibrio, these are the three organisms if you're testing for azithromycin, because enterobacterial you never test for azithromycin except for Salmonella typhi where you test for azithromycin, also Shigella. So Salmonella, Shigella, Vibrio, when you're testing for azithromycin, Staph aureus strain is the QC requirement. Not very important, you can ignore also. Next, so enterobacterial in general it is E. coli 27892, except carbapenem where Pseudomonas is recommended. The same Pseudomonas strain is also recommended for all non-fermenters. So you can see here Pseudomonas, Acinetobacter, Burkholderia, Cepacia complex, Tenotrophomonas, other non-enterobacterial. So in general, very simplified format is in general for all non-fermenter, the by and large ATCC strain or requirement for QC is Pseudomonas aeruginosa ATCC 27853, except when you are testing for few antibiotic like tetracycline and cotrimoxazole and minocycline, where your ATCC E. coli strain, because Pseudomonas is intrinsically resistant to this class of drugs. So therefore, Pseudomonas you cannot use for testing for these antibiotics. Therefore, ATCC E. coli is used for those antibiotics. Staphylococcus, I told you, dear friends, that Staphylococcus is an example where the ATCC strain requirement is different for disc diffusion and MIC. Disc diffusion it is 25923, whereas MIC it is 29213. And enterococcus, again a big difference. Enterococcus, enterococcus, if you're doing disc diffusion test, Staphylococcus aureus is the recommended strain, QC strain for enterococcus, except for high level gentamicin, where the enterococcus specific ATCC strain you have to use. However, when you are testing for MIC, you have to test against ATCC enterococcus. You cannot use ATCC staph aureus. Hemophilus is not very important. We can skip. The next is your pneumococcus. So all streptococci, the QC requirement is the same Streptococcus pneumoniae 49619 strain. So this is a summary of this. So I have beautifully explained in the summary slide. You can see that I have made a simplified summary slide. So this summary slide is very important for you. This is what you need to remember. Even the postgraduate student in the viva, they may ask you this QC strain numbers. So ATCC 25922 is the E. coli strain for enterobacterial and 27853 for non-fermenter. So these, and also, so what you need to remember is, for when you are testing for BLBLI, that is the combination agent like piptas, amoxiclav. In such case, you have to use a beta-lactamase containing strain of E. coli. So this is another QC number. Additionally, you need to remember, if you are testing for BLBLI like piptas, amoxiclav, and other BLBLI combination agent, you have to use a beta lactamase containing strain, that is ATCC E. coli 35218. And all streptococcus you have to use the same pneumococcus strain. So these four strains are both for disc diffusion and for MIC. However, Ho- However, the Staphylo and Enterococcus, for disc diffusion, the strain is same, whereas for MIC, they have the respective strains. I told you the Staphylococcal, the ATCC number is different for MIC, and Enterococcus, by and large, you use a separate and Enterococcus ATCC strain you need to use. Okay, so this is all about the requirement of the QC strain. So if you look into M100, M100 also has a detail. M100 also has a detailed table of the acceptable range of zone diameter. So it is exhaustive three-page ka table. I have made it simplified by incorporating the common antibiotics what we use in the laboratory. So when you test for example, when you test for QC strain of E. coli, again a point to be remembered: do not take the clinical breakpoint to measure the sensitivity or resistance pattern of the QC strain. Okay, QC strain, when you are testing against the antibiotics, there are acceptable QC range zone diameters. Similarly, MSc acceptable range also is available. You have to only make sure that the QC strain, the zone of inhibition, what will be produced, if they are falling within this range or not. I repeat, if they're falling within this range, then you have to consider that QC is pass or acceptable. If they will fall outside this range, like for example amikacin, when you are testing for ATCC E. coli, if it is less than equal to 18 mm or more than equal to 27 mm, then you have to tell that QC is fail. There is nothing like sensitive or resistant with respect to QC strain testing. QC strain testing, the zone diameters will have acceptable range given in M100, and your zone diameters when you test it should fall within this range. That's all. Do not use clinical breakpoint. I repeat, do not use clinical breakpoint to see that the QC strain is working or not. So this is again the table for the MIC QC range from M100. So the previous one is the diffusion, this one is MIC. And then I told you that when you're testing for BL, BLI agent, there are a number of BL, BLI QC strains. So these QC strains will contain the beta lactamase enzyme, and because these QC strains are having the respective beta lactamase enzyme, therefore when you test against this QC strain against a BL, I repeat, when you test this QC strain again against a BL and the respective BL, BLI, then it should exhibit a resistant near resistant breakpoint for the the BL agent, whereas BL BLI, because the BL BLI will inhibit this enzyme, this beta lactamase enzyme, therefore this is supposed to have a bigger zone. You cannot say it is resistant or sensitive because the QC zone, as I told you in the earlier side, the QC zone diameters are all a range of zone diameters. So a lower range of zone diameter is given in the acceptable range. I will show you in the next slide. So the lower zone diameter should come for amoxicillin when you test against this QC strain, whereas when you test against amoxiclap, it should show a increased zone or diameter. So these are the various lists. I have given you the most common ATCC E. coli strain. This is what we use. Other strain also you can use for testing against the respective BLBLIs. So yes, so these are the zone diameters, acceptable zone diameters for the BL-BLI combination. So you can see here, as I told you earlier, when you use ATCC E. coli 35218 strain, so this strain contains this plasmid. This TEM1 is a beta lactamase containing plasmid. So this particular strain, when you test against BL, that is ampicillin, for example, then the zone diameter what should be produced should be 6, and when you test against amoxiclav, it should produce a zone diameter within 17 to 22 then you can say that this BLBLI antibiotic disc is working. Okay, so so the QC strain containing enzyme is recommended to use for routine QC check for checking that the BLBLI antibiotic disc is working or not. Okay, so this is all about. So this is this is the first page, and this is the continuation of that. This is the second page. So it is a two-page exhaustive list given in CLSI. So this is how you have to test your QC strains. Okay, next we will discuss how to procure the QC strain and how you are going to maintain the QC strain, because this is another important aspect. QC strain need to be maintained very stringent condition according to the protocol. You should not have your own protocol. As Pallav sir has rightly said that the technician should not dictate terms how to maintain the QC subcultures, but you should follow the CLSI recommended guideline. Okay, so I will show you a very nice diagram. Dr. Ketan has helped me to make this flowchart. He prepared for this session. So what we have recommended here is, according to CLSI, you have to buy a QC strain from the manufacturer. after you buy a QC strain, what you have to do is you have to prepare 5 stock cultures. So those are called as FY stock culture, or these are called as uh, year, Y for year. Okay. So yearly stock cultures, or they are called as FY stock culture. So stock culture you have to make in which medium? The most commonly used medium is glycerol broth. So glycerol broth you can use. Otherwise, you can use 50% fetal calf serum, defibrinated blood. All that you can use. So these are the medium what you have to use, and by using five five subcultures you have to make. Okay, then after that what you have to do, these stock cultures you have to store in deep freezer, preferably at minus 60 degree centigrade. Why it is called as F? Because it is frozen. Okay, so these are frozen subcultures, so FY subculture. Then what you do is, suppose you have bought the QC strain this month, that is July, you have bought the QC strain. So you have to, for the first step is, after you buy the QC strain, you make 5 subcultures into the 5 glycerol broth tube, and you keep in the minus 60. And the second step is, from one subculture you prepare the monthly subcultures. So when you are buying the QC strain in the month of July, in this year there are total 6 month available. So you can prepare 6 monthly stock cultures. And the next January, that is January 2021, the second year QC strain you can remove from the deep freezer, from the minus 60, and from there you can make 12 subcultures representing for 12 months. So these are called as monthly subculture. So monthly subcultures are also need to be kept in minus 60 degree centigrade, and monthly subculture also need to be prepared from the same medium. Then what you do is, at the start of every month, like for example this month is July, so at the start of, okay, before that, what I want to say is, there are some QC strain, like for example Pseudomonas 27853, E. faecalis, and Streptococcus pneumoniae. These are the 3 QC strain for which bi-monthly subcultures are needed. So for this QC strain, you have to prepare the monthly subculture in pair. Okay, Jan 1 and Jan 2, like that, vials you have to prepare for these strains. For the remaining strain, one subculture is good enough. Then what you do is, every month, for example now July or June is going on, so what you do is, every month from this subculture you have to remove the vial from the deep freezer, and you have to thaw it. You have to thaw it means you have to allow it to liquefy. And after you do the thawing, you have to do a subculture to on the agar slant. You do a subculture on agar slant or agar butt, nutrient agar butts you can use. And there you have to prepare 4 stock cultures. Those are called as weekly subcultures, FW, or weekly subcultures. Then what you do is, the weekly subcultures, all you can keep the weekly subcultures in minus 20 to minus 20 is good enough. uh, Weekly subcultures, you either you keep in deep, otherwise the best is you can keep in 2 to 8 also, which is also acceptable. So keep in 2 to 8 degree centigrade. And then what you do is, every day you plate them, like for example the week one uh, agar slant, you plate on a fresh media. This plating a medium is usually recommended is blood agar is good enough. Tryptic soy agar also you can use, and for fastidious chocolate agar can be used. Every day you can do the subculture on the plates. Okay, so what after you do the subcultures, after you perform the QC strain, the daily subcultures plate need to be discarded. I repeat, the daily subculture plate you should not store, it need to be discarded. Weekly subculture plate, as I sorry, a weekly subculture vials, as I told you, you have to keep at 2 to 8 degree centigrade, and the monthly and yearly subculture vials need to be kept at minus 60 degrees centigrade. If you don't have minus 60, then minus 20 you can keep, but minus 60 is preferable. Remember a very important point, the last point what I have mentioned here: refreezing after thawing is strictly not recommended. Refreezing after thawing. Thawing means you take out the vial from the deep freezer and you allow it to liquefy, you allow it to defrost, and after defrosting, refreezing again is strictly not recommended, because by doing this the strain will lose viability, because the cytoplasm disabnormality will take place and the strain will lose viability. Okay, so now you have the next. These poll questions are over. No, all the poll questions are over. So can you display the answer here, please? Can you display the poll result, please?
I
So,
already displayed.
there are this question here is, if the laboratory switches from the daily to weekly plan. You know that the QC, we all are doing QC usually weekly, but there are two format to do QC. Either you can do QC daily or you can do weekly. Okay, so here the answer is, for the laboratory where the distribution for patient isolates are performed less than once a week, that is if the load is very less, so that the AST you are not doing every day, AST you are not doing every week also, less than once a week you are doing AST, then you have to do a daily QC testing. Okay, so the QC testing frequency is of two types: daily QC testing or weekly QC testing. Daily QC testing is done for those small laboratory where the sample load is very less. If the disk diffusion are performed less than once a week, then the QC is performed on the test day. Daily QC testing means no need to do every day. Whichever day your lab is putting AST for the patient sample, on those days you have to, in parallel, you have to run the QC. This is called as daily QC. However, your load is good. You are doing QC on you are doing AST for the patient sample on a daily basis. Your load is good. Then you no longer require to follow a daily QC testing. You can switch over from a daily QC testing to a weekly QC testing. However, this switchover you cannot do it randomly of your own. You have to go through a process called as 20-30 days plan or 15 days replicate plan. Either of these two plan you can use to validate your laboratory that you are eligible to perform weekly QC testing. So what are these two plans? I am going to show you in the next slide. This slide is very important, in fact the most important slide of this session. In a 20-30 days plan, what you have to do is you start putting, so this plan is applicable for a drug bug combination. So let us say you want to test for amikacin, you want to test for ATCC E. coli QC strain. So ATCC E. coli amikacin you want to test. Your lab was doing this test on a daily basis earlier. Now your load is more, your patient load is more, so you want to jump to weekly plan. So what you have to do is you start putting the QC, the amikacin the E. coli QC. You have to test daily for 20 days. Okay. So in 20 days, how many results will be there? You are testing amikacin against ATCC E. coli. You are testing amikacin against ATCC E. coli, and you are testing every day once. So in 20 days, how many results will be there? In 20 days, you will have 20 results will be
Seriously.
available. So out of the 20 results, if the QC fail in 0 or 1, can you mute please? Or mute no? Please don't go from the screen. You have to wait and see that. Organizers, please mute everyone.
Sir, your voice is not clear. Can you repeat, sir?
Yes. So I am repeating. So if the QC, so you want to test amikacin E. coli, amikacin against ATCC E. coli you want to test. So you go for a 20-30 days plan where first you test for 20 days and here you will have 20 results of amikacin E. coli. Among the 20 results, if all the results are within the range, in range means it is called as pass, and out of range means it is called as QC is fail. Okay, so if you have either zero fail or only one fail, then you consider that the QC is the QCR testing is successful. You can switch over to from the daily plan to weekly plan. If you have more than equal to 4 fail, then it is called as QC is fail. So you have to consider for you have to initiate the corrective action why it has happened, and till it is fixed you have to continue the daily plan. You don't switch over. You are not allowed to switch over to the weekly plan. You have to look for the corrective action, and if the issue is resolved, then you have to restart the 20-30 days plan again. Next, if you have 2 to 3 QC fail in 20 result, then you have to repeat the QC for another 10 days. That is why it is called as 20-30 day plan. You have to repeat for another 10 days, and so that means how many results will be there? 20 results are available here. 10 results are available here. So total results available will be 30. So among the 30, if you have 2 to 3 fail, then it is considered as QC is pass. If you have more than equal to fail, more than equal to 4 fail, then it is considered as QC is fail. Again, you have to initiate the corrective action. Okay, so when you are performing for another 10 days you are performing when you have 2 to 3 fail. 2 to 3 fail means there are two situations here. Either you will have a 2 fail or you will have a 3 QC fail initially. Then when you repeat the QC for another 10 days, in that if you have 0 fail, eh, among the 10 result, if you have 0 fail or if you have 1 fail, then altogether the total fail are 2 to 3. In such case, you have to consider that the QC is pass and you have to switch over to weekly. If you are if you have if it is more than equal to 2, that is 2 or more fail, then the QC is fail, because altogether it is more than 4 fail. Here 2 fail, here 2 fail, total 4 fail. Similarly, if initially 3 fails are there, then if you have 0 fail later, then you can consider that QC is pass. If you have more than equal to 1 fail later, then altogether the fail will become more than 4. You have to consider that the QC is fail. So this test is good, but the thing is it will take 30 days of time. If you want to reduce the time, then there is a 5-day plan. In the 5-day plan, it is also called as 3 into 5 uh, replicate plan. Means what? You have to do QC in triplicate for 5 days. Amikacin against ATCC E. coli, you have to test in triplicate, that is 3 times a day you have to do for 5 days. So totally how many results will be there? You have totally 15 result. Out of the 15 result, if you have 0 or 1 fail, then you consider as pass. If you have more than 4 fail, you consider as fail, and you initiate the corrective action. And if you have only 2 to 3 fail, then in such case you have to repeat the QC in triplicate for another 5 days. So you have 15 day, you have 15 results earlier, and now again you have another 15 result. Altogether you have 30 result. Out of the 30 result, if you have 2 to 3 fail, then you consider as pass. And if you have more than equal to 4 fail, you consider as there is some problem. You have to consider the corrective action. Okay, so this is the clear cut transparent guideline how to jump from a daily plan to a weekly plan. So this plan is required. This method you have to follow when you're jumping from a daily plan to week plan, or if your lab is having no plan now and you want to start a weekly plan, then also you have to perform this. I repeat, suppose your lab is not doing any QC now. After this class you got inspired and you will go back and start QC. So from a no plan you want to start weekly plan. Again at that time also you have to follow the same, either this plan or this plan, and then only you can start weekly plan. Till weekly plan is not started, you have to continue the daily QC plan. Okay. So apart from that, there are some situations where additional QC testing is recommended. Like the in a weekly plan, in a weekly plan, you have to do QC once in a week. Like you fix a date that every Monday you want to run the QC. So apart from once in a week testing, in a weekly plan, there are some additional QC testing recommendations. Those recommendations are if you change the manufacturer of disk, or if you change the MHA medium manufacturer or lot number, all that if you change, or if you have any method of change in the inoculum turbidity measurement, like you are using a manual method of a measurement of zero point 0.5 McFarland by using the card what we have shown you yesterday, and now you want to jump to the density check or the photometry device you want to buy, and you want to check your turbidity. So whenever you have a change in the inoculum turbidity measurement method, also you have to test additionally. And when there is a change in the zone reading method, like you are using one scale type you are using earlier, and now you have bought a vernier caliper, and with the help of vernier caliper you want to measure the zone. So if you have a change in the zone reading method, and nowadays even automated zone readers are also available. Nowadays even automated zone reader, Biorad is a company which is having an automated zone reader. So like from a manual zone reading you want to change to automated zone reading, again you have to perform additional QC testing. So this is the exhaustive list of CLSI M100 where additional QC testing are required. We have made a simplified table out of this. So this is the simplified table. So this, if you have a change in the disk, you want to use a new manufacturer or new antibiotic or new shipment lot, or you want to change, you want to use a new MHA, either a new lot number of MHA or a new manufacturer of MHA, or as I told you, inoculum turbidity measurement, like from visual method you want to go to the photometric method, or you have a zone reader change. Okay, all these are the situation where you have to test for additional QCs, and these are the additional QC recommendations. Some places you have to just test once and you have to go ahead. Some places you have to test for 5 days consecutively, then you have to go ahead for the weekly plan. Some places it has, like for example, if you want to test for a new antibiotic, You have never tested ceftazidime avibactam. Now you want to start doing. So it has to be considered as from the beginning, and you have to go for a 20-30 days plan, or 3 to 5 days, 3 into 5 replicate plan. And if it pass only, you can start the daily QC. Till such days, till all these are passed, you have to run daily QC. The weekly QC you cannot start unless it is passed. Okay, now there are one more MCQ here. So there are three MCQs are there are together here. This all three MCQs are related to if you have a QC fail, what you have to do. If you have a QC fail, then what you have to do. So this is a question where out of range QC result in a daily test. So in a daily test, if you have a out of range QC result, no correct, only one result is there, no corrective action has to be taken. This I will explain you all this later, so I'll just show you the answer here. The next question is, in a daily QC test, one the repeat test also falls in range and the cause is identified, then the corrective action is taken for the error is been fixed. If the cause is identified, if it is identifiable error, then the error has to be corrected. The next question is in a weekly plan. Weekly plan, this is the answer. I will explain you this in my subsequent slides so that you will understand this question appropriately. So this all these three questions are related to out of range QC result. If you have out of range QC result, then what to do? The first thing is, you have to see that whether the error is identified or not. You go for a daily plan or a weekly plan, any of the plan. If the error is identified, then this kind of error is called as identifiable error. Here the error is rectified. The repeat QC test after the rectification has to be passed, because you have identified the error, so it will pass. And after that you can continue the daily or weekly plan. There are various type of identifiable error. The errors may be a QC strain related error, like the QC strain has become contaminated because of improper storage, improper subcultures. It has become non-viable, or repeated thawing. If you do, it will become non-viable. And all these are QC strain related error. Then testing supplies error, like the MHA or disk related error. Whether you have improper storage of MHA or disk, or you have a too thin or too thick MHA or medium expired antibiotics. All these are MHA and disk related error. Testing process related error, you have not done subculture properly, you have not put the AST properly, there is a reading error, or the wrong disk you have chosen, MHA placed incubation time is wrong. All these are called as testing process related error. And the fourth one is equipment related error. The classical example is the pipette what you use for taking the broth, or the photometric device what you use for the densimeter checking. All this if not functioning properly. So if cause is identified, any of this cause, then the issue is easy to then the problem is minimal, because the error can be rectified and the daily or the weekly plan can be started. If the error is not identified, then on a daily plan, the rule is repeat the test on the error day. And if the repeat test is passed, it is called as random error, and you can ignore this and you can resume back to daily plan, because you are running a daily plan. Already you are running a daily plan, so you can ignore this and you can resume to a daily plan. Okay, they say that the random error can occur due to by chance also. Even it may occur even when the test method is followed correctly and all QC material are maintained correctly, and therefore you can ignore the random error. However, if the repeat test is fail, this is called a system related error, and for which the corrective action need to be taken. The list of the corrective action I will show you in my subsequent slide. Then if you are going for from a daily to weekly switchover, in that I told you that more than 4 fail in 30 days, then also it is called as a system related error, and you have to you have to take the corrective action. So these are the action plan what you have to do. In a weekly QC test, again the rule is same, you have to repeat the test on the error day. After you repeat on the error day, what you have to do is you have to check the last 5 QC result. If you have at least 5 QC result, pass QC result, using the same lot or same lot of antibiotic or the same lot of MHA are available, then you can class it as random error and you can resume back to weekly plan. I repeat, in a weekly QC fail, you have to repeat on the error day, and after repeating on the error day, if you have 5 acceptable QC result available in using the same lot of antibiotic and MHA, then you call it as random error and you can resume back. If 5 acceptable QC results are not available, you call it a system related error and take corrective action. So I'll tell you what is the meaning of 5 acceptable QC result. I have some examples to show you. 5 acceptable QC error means what? You can see this example here. The lab is doing weekly QC test. Every week once the lab is doing, and this is the this example is for amikacin against sorry, ampicillin against E. coli, and this is the acceptable range. So 18, according to this, 18 is pass, 19 also is pass, again 18 is pass, 19 is pass, all these are pass. The result which is fail is 14, so this is a fail result. So because this is a failed result, you have repeated on the error day, and the next day result shows it is pass. So you can see here 1, 2, 3, 4, and this is 5. So there are 5 pass results are available using the same lot of MHA, and the lot numbers are same. So the lot number of MHA and lot number of discs. So these using the same, you have a 5 pass QC results. So you can resume back to weekly plan. I have one more scenario. In this scenario, the fail result happened on the week 3. The third week, you have a fail result. So you have to see that going back, how many past results are there. Going back, you have only 1 and 2. 2 past results are there. You need total 5 past results. So therefore, what you have to do is you do repeat for 3 more days continuously as a daily plan. You do repeat for 3 more days, so that you will have 3 more past result. Altogether you will have 5 past result, then you can resume back to weekly plan. So this is how you have to do, this is how you have to handle the random errors. Random errors you have to handle like this. Suppose you are not able to get 5 acceptable QC result, then it is called as a system related error, and for all system related error you have to take corrective action. So this is my summary slide for today's session. In a daily QC plan, you have to first see whether it is identifiable error or not. If it is identified, you have to correct the error. If in a daily QC plan, if the error is not identified, then you do repeat the test. If the test is showing random error, you can just resume back to your daily plan. Error is not identified, repeat test fails, then it is called a system error and you take the corrective action. Weekly plan is slightly different. If the error is identified, the rule is same, but if the error is not identified, then you should have 5 pass QC result. You should have 5 pass QC result, then you can call it as random error and no corrective action to be taken. You can resume back to weekly plan. But if you do not have 5 QC result, pass the 5 pass QC result, if you don't have, then you have to take corrective action. Until corrective action is been taken, you have to resume back to daily plan. So what are the corrective actions? If you look into M100, then you can see that the list of corrective actions, there are some 4 to 5 pages of corrective actions are there. So these are the various antibiotic agents, these are the QC strains, and these are the observations. If you are seeing, then this could be the probable cause, and this should be the action plan. So like that, they have given a 3 to 4 page ka document. You have to sit together and you have to discuss with your technician, and you have to go through this chart, and you will see that what the error could be, whether the pH is changed, or the medium composition is changed. You have to look into every minute detail to take the appropriate corrective action. Okay, so again a point to be remembered, that zone reading variation is a big problem in the laboratory. Therefore the CLSI recommends annual or semi-annual competency testing. Your technicians or your PG student, whoever is reading the zones, they have to give an annual exam or a semi-annual competency or testing, so that the reading of a set distribution results of the lab personnel need to be matched with that of an experienced reader. So you can designate who is the experienced reader, either the consultant, or the QC expert faculty can be the experienced reader, and to their reading, the zone reading of the lab personnel need to be matched, and up to 2 millimeter size variation can be considered as acceptable. If it is MIC, then up to 1 dilution is considered as acceptable. So you have to have a competency testing in place, because it is always advisable that the persons who read the zone diameters, they should be adequately trained. So this is all about the session. I hope uh, I have told in detail about diffusion. The MIC QCs are more or less same as like 80 to 90%. The principle of MIC QCs are same, except that the strains are different. The strains I have shown you in the first slide. The strains are different, and additional test when you do, like if you buy, if you procure a new Vitec card, like now Vitec 405 406 cards are available. So if you procure new Vitec card, you have to do additional testing. So like that, the minor differences are there. Otherwise, by and large, the principles and the action plan criteria, all these are same as diffusion test. Okay.
I have a query. Can I ask?
Yes, yes.
Sir, in a 20-30 days plan, suppose after 20 days, there are 2 to 3 results which are out of range, or those are out of range. So we, according to the criteria, we go for 10 days plan. So to make it 30. So this 10 days after completing the 20 days plan with a 2 to 3 out of range result, should the corrective action be placed there, or it is just continued for another 10 days? Not hear you.
Sir, your audio is off.
Okay. So what I told you is 2 to 3 fail. You have to test for another 10 days. Another 10 days may altogether, that is 20 results earlier and 10 results later. Altogether, if you test for if you have 2 to 3 fails, then you can go ahead for weekly plan. You can tell that it is pass. If you have 4 or more fails, then you have to initiate the corrective action.
Thank you. Thank you so much, sir.
Yeah.
I have a question. Can I ask?
Yes, yes.
Yeah. So what about releasing the clinical reports on a particular day if the weekly QC fails?
If you strictly go by CLSI recommendation, then the clinicians then the clinical result need to be withheld till the appropriate corrective actions are taken. But you have to see in your situation how you are going to manage.
Okay, sir. Thank you.
Okay. So this is all about the session. So this is again for postgraduates, particularly